Hello and welcome back to the channel. I hope that everybody is doing well today. If you are new here, then hi, my name is Brittany and I'm a nurse practitioner. I'm also the creator of the Brittany Holzbeck NP Review. It's the most comprehensive and affordable nurse practitioner boards review on the market. It is also accredited through the AANP, and so if you take the course, you can collect 15 continuing education credits. Everything is available on my website at thenewNP.com. I also have a pharmacology crash course over there, clinical pearls for the new NP, and just lots of other good stuff, so definitely go ahead and check it out. I'll have everything linked in the description box below if you do want to give it a look. Otherwise, in today's video, I'm going to be doing a review of some of the most commonly used diagnostic imaging that we use in healthcare. So I'll go over ultrasound, X-rays, CT, and MRIs. It's a ton to go over. Technology is so super cool. So we are just going to get right into today's content. But really quick, before we do, if you could just do me a huge favor, like the video and subscribe to the channel. It is a free way to help me out and I really do appreciate it. All right, so first up, let's talk about ultrasounds. So an ultrasound machine, it's also known as sonography machine. It's a medical device that uses high frequency sound waves to create images of organs, tissues, and then blood flow inside the body. It is a non-invasive diagnostic tool and it's used in various medical fields. So ultrasound imaging is based on the reflection of sound waves. Like what? When the machine emits high frequency sound waves, they travel through the body and they bounce off tissues. The transducer emits the sound waves and then receives the echoes that return, converting the sound waves into electrical signals, which are then processed to create visual images. And so the time it takes for the echoes to return to that transducer and their intensity determines the image's depth and brightness. So there are various types of ultrasound. There are 2D ultrasounds, which produces those flat, two-dimensional images of internal organs. It's commonly used in obstetrics and also it's used in abdominal imaging as well. There are 3D ultrasounds, which provide three-dimensional images, offering a more detailed view and especially is useful in fetal imaging. There is a Doppler ultrasound, which measures the flow of blood through blood vessels by assessing the change in frequency of the sound wave, very helpful in cardiovascular assessments. And then there is also bedside ultrasounds, and so this is just a portable device. These are specifically used in emergency or point of care settings, and these can be rapidly performed and interpreted by the operator. So let's talk about the various applications of using ultrasound because there are many. So like I said, it's used in obstetrics and gynecology. It can monitor fetal development during pregnancy, so assessing fetal health, diagnosing any conditions that are present, if any. Also, it's used for evaluating conditions related to the ovaries and uterus. It is again used for abdominal imaging, so we can evaluate the liver, gallbladder, pancreas, kidneys, spleen, appendix. Ultrasound can detect gallstones, cysts, tumors, other abnormalities. It's used in cardiology to perform echocardiograms, which assess heart function and structure. It can also evaluate blood flow and detect structural heart issues. It's used in musculoskeletal imaging, so it can assess muscles, tendons, joints, ligaments. We can be looking for injuries. It's used in vascular imaging to evaluate blood flow and detect blockages or venous insufficiency. And then it's also used in guided procedures. So for example, assisting in needle placement for IV access or even biopsies by providing those real-time visualizations of the structures. There are multiple benefits of ultrasound. Again, it's non-invasive. So there are no incisions or injections that are required. It's safe. It does not use ionizing radiation, and it provides real-time imaging. So we get live images which allow for dynamic assessments. And again, too, there are portable options, so they can be done right at the bedside if needed. Of course, there are some limitations as well to keep in mind. One, and this is the biggest one probably, it's operator dependent, meaning image quality and diagnostic accuracy can vary depending on the operator's skills and experience. And then two, it does have limited penetration abilities, so it can be less effective for imaging structures that are deep within the body or if patients have significant obesity. All right, so let's talk a little bit about X-rays now. So an X-ray machine is a medical imaging device that uses ionizing radiation to create images of the internal structures of the body. X-rays are primarily used to diagnose and evaluate a variety of conditions, particularly those that affect bones and certain soft tissues. So X-ray imaging operates on the principle of differential absorption. When X-rays are directed towards the body, some rays pass through while others are absorbed. This absorption varies depending on the density and composition of the tissues. So there are a few different types of X-ray machines. There is the conventional X-ray machine. This uses film-based technology. It requires developing images after exposure. There's digital X-ray machines. This utilizes digital detectors that enable immediate image viewing and manipulation. Radiation exposure is often lower than those conventional methods with this. There is portable X-ray machine. So this is a compact machine that allows, again, for bedside imaging. This is commonly used in emergency settings or for patients that are unable to move. And then there's fluoroscopy, which is a type of X-ray that provides real-time moving images of the interior of the body, and this is often used to observe the digestive tract. There are also many different applications for X-ray imaging. So we have skeletal imaging. X-rays are primarily used to detect fractures, bone infection, arthritis, and other skeletal abnormalities. Chest X-rays, these are very helpful in evaluating lung conditions such as pneumonia, tuberculosis, and heart enlargement. Dental X-rays, this allows for visualization of teeth, jawbones, surrounding structures to identify cavities, infections, and other dental issues. And then mammography. This is a specialized X-ray used to examine breast tissue for early signs of breast cancer. And then finally, interventional radiology, which are X-rays that are used to guide minimally invasive procedures such as angioplasty or catheter placement. There are multiple benefits of X-ray imaging. One, they're quick and efficient. X-ray exams typically take only a few moments to perform. Therefore, they can provide near immediate results, assuming that you have someone that's able to interpret them, of course. They are, again, non-invasive, painless. They do not require any type of surgical intervention, and they are widely available. So they are common in hospitals and clinics, making imaging accessible for various conditions at a variety of facility types. Of course, there are some safety considerations when it comes to X-rays, much of which involves the exposure to ionizing radiation. While the levels are generally low, it's important to minimize exposure, especially for pregnant women and children. Protective measures such as lead aprons or shields can be used to protect parts of the body that are not being imaged during the procedure. Technicians can also stand behind protective barriers when the X-ray is taken as well. Preparing for X-rays is quite simple. Patients might be asked to change to a hospital gown if needed. They should avoid wearing jewelry or clothing with metal fasteners because this can interfere with the images taken. And then healthcare providers should always ask about any previous X-rays, current medications, or if the patient is pregnant or breastfeeding before performing an X-ray. All right, so next up, a CT scan. A CT, or computed tomography scan machine, is a medical imaging device that uses X-rays to create detailed cross-sectional images of the body. CT scans provide more information than those standard X-rays by producing images of organs, blood vessels, and bones, allowing for a better diagnosis and treatment planning. CT scans use a rotating X-ray beam to capture multiple images or slices of the body from different angles, and they are processed by a computer to create cross-sectional views. There is the conventional CT, which provides cross-sectional images of the body, and these are typically used for diagnosing a variety of conditions. There is high-resolution CT, which offers more detailed images. It's particularly useful for lung imaging. There is helical or spiral CT, and this acquires continuous data, allowing for faster scanning, improved image quality. It's especially useful in trauma situations. And then there is CT angiography, which uses contrast to visualize blood vessels and then assess conditions such as aneurysms or blockages. There are many different applications of CT scans. They are used in trauma assessments because, again, they are able to quickly evaluate for injuries to the head, chest, abdomen, pelvis after any traumatic incidents. They are used in oncology to detect tumors, evaluate for metastasis, also assess treatment effectiveness. They are used in pulmonary imaging to assist in diagnosing lung diseases, including PE or pulmonary embolisms, also infections. They are used frequently for abdominal imaging to evaluate conditions that are affecting organs such as the liver, the pancreas, kidneys, and intestines. And then they are also used in guided procedures. So for example, assisting in biopsies or placements of drainage tubes by, again, providing those real-time images. Of course, the benefits of CT scans are notable. For one, speed. CT scans are typically quick, often completed just a few minutes, making them ideal for emergency situations. Two, they provide detailed images, so comprehensive views of internal structures, leading to a more accurate diagnosis. Three, they can be non-invasive. Generally, they're painless. Most procedures require little to no preparation, although contrast material might be used, which would require IV access. The contrast agent is usually iodine-based. It's injected to enhance visibility of certain structures. It is imperative to check that the patient does not have any allergies, especially to iodine or shellfish, because there is cross-reactivity between the two. One big safety concern with CT is going to be radiation exposure, as CT scans expose patients to even higher levels of radiation when compared to standard X-rays. And though the benefits typically will outweigh the risks, it's so important that we minimize unnecessary scans. All right, and then lastly, let's talk about MRI. So MRI stands for magnetic resonance imaging. These are advanced medical imaging devices that use powerful magnets, radio waves, and a computer to create detailed images of the organs and tissues within the body. MRI is particularly useful for visualizing soft tissues, making it an essential tool in diagnostics. So the way that MRI works, this is crazy to me. I need to research who developed the MRI. Real quick history lesson if you're interested like I am. There's Raymond Vahan Damadian. He was an American physician and inventor of the first magnetic resonance scanning machine. It was his research into sodium and potassium within living cells that helped his proposal for the first magnetic resonance body scanner in 1969. Damadian's initial efforts were successful in identifying indicators for cancer. However, there were some flaws for practical use. Enter Paul Lauterbur. He was an American chemist who shared the Nobel Prize for the development of the MRI, and he shared that with Peter Mansfield, who was an English physicist. So Lauterbur said he was actually at a big boy when he scribbled on a napkin his concept of the first model of the MRI and how it could produce images of the body. I just thought that was interesting, but now back to regular content. It uses a strong magnetic field to align the protons in the body, primarily in water molecules, and then when radio frequency pulses are applied, these protons are knocked out of alignment. And then as they return to their original state, they emit signals that are captured to create images. That is so cool. As with the other diagnostic imaging, there are various types. So there's a closed MRI. This is the traditional MRI where the patient lies within a large tube-shaped magnet. This provides high quality images, but may cause discomfort or claustrophobic patients. And I can attest to this. I had so many MRIs growing up, and yeah. There is an open MRI, which has a larger open design, offering more space around the patient, thereby reducing those feelings of claustrophobia. However, it can have lower image quality than those closed systems. Then there is what's referred to as a functional MRI. This measures and maps brain activity by detecting changes in blood flow. This is often used in brain studies and planning for surgical procedures. And then finally, a contrast MRI involves the use of gadolinium-based contrast agents, and this is to enhance certain tissues or blood vessels for an even clearer image. So MRIs are used for many different purposes. They are used in neurology quite often. So for example, MRIs are used to diagnose and monitor brain conditions such as tumor, stroke, multiple sclerosis, and traumatic brain injuries. MRIs are used in musculoskeletal imaging to assess joints, ligaments, muscles, and cartilage for injuries, again, or degenerative diseases. They are used in oncology as MRIs help to identify and delineate tumors. They are also used to monitor a patient's response to treatment. They are used in cardiology as well to evaluate the structure and function of the heart and blood vessels. And then they are also used in pelvic imaging to assist in visualizing reproductive organs in both men and women. And they help to diagnose conditions like prostate cancer and uterine fibroids. There are many benefits to using MRI. So it is non-invasive. MRI typically does not require incisions or invasive procedures. making it safer, more comfortable for the patient. There is no exposure to ionizing radiation. So unlike the X-rays or CT scans, MRI does not use the ionizing radiation, which of course reduces the potential risks associated with exposure. And MRIs provide detailed, high contrast images of soft tissues, allowing for accurate diagnosing of various conditions. There are a couple of safety considerations here. One being that it is, again, a very strong magnetic field, and so this can attract ferrous metal objects, and so healthcare providers must inquire to the patient about any implanted devices. So for example, pacemakers, metal clips, or any other metallic items. I experienced this as a child because my dad could never come into the room with the MRI because he potentially had slivers of metal in his eye because he was in construction, so they wouldn't let him in the room. So definitely need to be asking your patients about any metallic items on them because the magnet will rip those babies right out. Also, again, those claustrophobia concerns. Some patients might experience anxiety due to that enclosed space. So open MRIs or even sedation is an option for those that are particularly uncomfortable. And then again, contrast reaction is a potential concern in cases where that gadolinium contrast is used. Always important that we question our patients about any allergies, of course, that's foundational stuff, or if they've had previous reactions to contrast materials beforehand. But all right, I think that is going to complete today's discussion. Hopefully you learned a bit. I know that was a lot of information in kind of like a short amount of time. There is so much to learn there, but hopefully you feel like you have a better grasp on the concept with that discussion we had. Don't forget, if you're prepping for your nurse practitioner boards, then definitely check out my accredited boards review at thenewNP.com. Again, there's also lots of other educational resources there. So if you're a nurse practitioner student, a new nurse practitioner, a licensed nurse practitioner, tons of clinical content. So make sure you check it out. It's thenewNP.com. Everything will be linked in the description box below. But otherwise, that's going to complete today's discussion. Don't forget to learn something new every day, and I will talk to you guys in the next video. Bye, guys.